So greetings everyone. I'm Rogers Mwangi, the co-founder of Sheria Clinic. Sheria Clinic is a legal aid firm that champions to educate the general public on matters of the law. In today's topic, we shall be discussing a critique of the mental health laws in Kenya. And our keynote speaker today is Madam Irene Baru, who is a corporate consultant and also the founder of Bike It Deliveries, which has its operations both within Nairobi and outside Nairobi. She's also a writer and a mental health advocate. Without any further ado, welcome Madam Irene. Let me make you a presenter as you introduce yourself.
Thanks, Rogers. You've already introduced me. Good evening, everybody. I hope you can hear me.
Yeah, we can. Yes, we can.
Okay, sawa. So we're ready to start talking about mental health and the law. I want to share my screen. You let me know if you can see it.
Yes, we can.
Yes, we can.
Okay, sawa. So I'd want to begin by asking if anybody has encountered a person suffering from a mental health condition or has suffered from a mental health condition themselves. Anybody? You can just unmute yourself and say your name and whether you have encountered something like that. Rogers, we can start with you.
Personally, I know of a cousin who was bipolar and she had to survive on medicine to help her, and she's coping quite well.
Okay, sawa. So I'm sure the term mental health is not new to a lot of us. And mental health is very intertwined with public health and personal health. So we'll begin by defining what health is. And health is a state of complete physical, mental, and social well-being, not necessarily the absence of a disease. So basically, if you're in a proper mental position, then you're healthy. So mental health is a state of well-being where a person can recognize their abilities and they're able to cope with the normal stresses of life, work productively and fruitfully, and make a contribution to their communities. So positive mental health is things like emotion, cognition, social functioning, and coherence. I know we are all lawyers, so I hope Kizungu haiwachangani. Then we've been hearing a lot of mental health of late. There's conversations everywhere, especially on social media, about depression, about people attacking people with mental health conditions. We've been hearing all that, and I'm sure we are all wondering why mental health is such a big thing. Mental health is a key determinant of overall health and socio-economic development. So when you're checking indicators of a country's performance, like say even economically, health is one major indicator, and mental health is something that was previously ignored or looked down upon. For example, Kenya allocated 0.8% of its budget, like a very little amount of money towards mental health in previous years, as seen by WHO. So mental health is important because it influences lifestyles, physical health, the recovery from illness, limitations in living, higher education attainment, productivity, employment, basically all aspects of life. So there are two categories of mental health conditions because ill mental health is now what we know as mental disorders and mental health conditions. So these mental health conditions are characterized by alterations in thinking, mood, or behavior associated with distress or interference with personal functions. So there are two categories. There's intellectual disabilities. These are These are developmental conditions, and they affect the way an individual learns, communicates, and undertakes day-to-day activities. So these ones can include Down syndrome, fetal alcohol syndrome, autism, ADHD, and brain damage. So these are basically things that you're born with, or you develop during childhood. Then the second type of a mental health condition is called psychosocial disability. So this is basically a condition that affects your social life and your social life because your mental state is imbalanced. So this include anxiety disorders, mood disorders like depression and bipolar, eating disorders like bulimia, anorexia, and obesity-related conditions. And then also it can be caused by drugs and alcohol-related mental illnesses. So the symptoms of these disorders, they're unique depending on the individual. So now we're done with the definitions. So now we want to see why it is necessary to have adequate legal provisions for people living with mental health disorders. So when we say that people living with mental health disorders experience higher rates of disability and mortality, this is true in the sense that I'll give an example with depression. A lot of depressed people, some depressed people, not a lot, let me not use a lot, end up committing suicide. Then mental disorders lead individuals and families into poverty. It's very expensive to treat mental health conditions. Then you find that homelessness and inappropriate incarceration, like kushikashikwa kwa streets, is common among people with mental health disorders than for normal people. For example, if you go out there to the streets, you find that there's a lot of people who are either depressed, who have bipolar, like the madmen you see walking around on the streets. It doesn't necessarily mean that they're homeless, but probably the mental state led them away from home. Then it also increases the chances of marginalization and also affects the vulnerability of persons. Then people with mental health disorders, I'm sure mmeona vile wenda wazimu hutritiwa kwa barabara, they're pushed around, they're insulted, so they're treated in an undignified manner. So people with mental disorders have their rights violated a lot. A lot of them also, like in the communities, if you've seen like a family that has a person living with autism or what, especially if they're not able to access information about the condition, they're likely to restrict the person from working. They're also likely to stop them from going to school so that they don't cause havoc. They're also not likely to be allowed to bear children. They're also really not generally allowed to get out and interact with other people. Then people with mental health disorders could also be subjected to unhygienic and inhumane living conditions. They might be physically and sexually abused, neglected, and treated in a degradeful manner, especially even in health facilities. They're also denied civil and political rights, such as the right to marry and found a family. We've talked about personal liberty. They're not allowed to move around by themselves and when they want to. They're also likely to be restricted to exercise legal capacity. I'm sure you've seen a lot of in laws, in a lot of classes, you talk about mental capacity to execute contracts, to execute wills, etc. So they're not allowed to exercise such legal capacity. So generally they're just marginalized and they're not able to interact with the society. So the legal framework for mental health, we'll start with international law. So Kenya has ratified some international laws that touch on mental health. An example is the Convention on Rights for Persons with Disabilities, which enshrines the right to legal capacity under Article 12 and equal access to justice for persons living with disabilities. Here, mental disorders are treated as disabilities. And in Article 13, talks about equal access to justice. And Article 19, the right to live in the community on an equal basis with others. So other instruments that touch on mental health, there are quite a number. I won't read all of them, but Universal Declaration on Human Rights, the International Covenant on Economic, Social, and Cultural Rights, Convention on the Rights of the Child, etc. Then we go to the domestic legal framework. Other than I'm sure everybody is aware of the rights enshrined in Chapter 4 of the Constitution of Kenya. Those apply to even people with mental health disorders. So according to the Mental Health Act, Section 73, it says that an act of parliament, there shall be legislation on mental health to protect the rights of individuals suffering from mental disorders, to ensure the custody of such persons and the management of their estates as necessary, to establish, manage, and control mental hospitals having sufficient capacity to serve all parts of the country at the national and county levels, advance implementation of other measures introduced by specific legislation in the field of mental health, and also to ensure that research is conducted to identify the factors associated with mental health. So after that, we go to the Mental Health Act. This act was enacted in 1991 and revised in 2012. We're in 2021. If you can't see a problem, I'm sure you have a problem yourself. So this one focuses mainly on inpatient admission and provides for prohibition of ill treatment in hospital, including how to examine females. I want to go back a bit. I added this after I'd already finished doing the presentation, and define a person with a mental health disorder according to the act that is currently in use. So it means a person who has been found to be so suffering under this act, and includes a person diagnosed as a psychopathic person with mental illness, and person suffering from mental impairment due to alcohol or substance abuse. So a psychopathic person is a person who is suffering from a chronic, this is a definition, an Oxford Dictionary definition, is a person who's suffering from a chronic mental disorder with abnormal or violent social behavior, commonly defined as an unstable and aggressive person. I need you guys to understand what the Mental Health Act defines a person with a mental health condition as. And then you compare that to the two types of mental health disorders that we've spoken about. Then we go to the provisions of the Mental Health Act. It also advocates for institutionalization of people with mental health conditions. As a result of this, if you go especially to the villages and to the informal settlements, you'll find that if you tell people that you have a mental health condition, you're likely to be asked, umechizi? Or if anybody is suffering from a little an instability, you're likely to find that they've been taken and dropped off at Madare and left there to be treated. So this act does not provide for consent to treatment. You find that a lot of times people will just be grabbed and taken to a mental institution. Like for disorders like bipolar, you have a person who has extremities in moods. So you find that sometimes they're violent, sometimes they're super depressed, and sometimes they're just okay. So when you say consent to treatment, like for a person like that, should society wait for them to come down to when they're functioning normally to allow them give consent to be taken to a mental institution? Then it also does not provide for confidentiality of the patient's details. It does not provide for access to information on the mental health disorders. It does not provide for conditions in the mental health facilities. So basically, these are the small laws that govern mental health in the country. And that is what has been going on up until 2019. I don't know how many of you listened to the President's Madaraka Day address in 2019. In 2019, the president issued a directive for formulation of appropriate policy response at national and county level owing to an increase in cases of depression. So recently, I think it was last month, when Nairobi, there was a report, not a report, a study that showed Nairobi to be one of the most stressful cities. This is not recent. That research finding has been in since 2019. And that's when the president realized there's not sufficient laws that talk about mental health in the country. Yet, since 2015, there has existed a mental health policy. So this mental health policy that was introduced in 2015 and supposed to go up to 2030 seeks to address the systemic challenges, emerging trends, and mitigate the burden of mental health problems and disorders. So this policy admits that there's a gap in the existing legislation in the protection of the rights of people living with mental health disorders. It admits that we don't have enough systems to provide mental health services, and even we don't allocate sufficient resources to research in mental health. So what this policy proposes to do is to align the mental health services with the Constitution of Kenya and with the national and global health agenda. It also seeks to address the medical health systemic challenges, emerging trends, and mitigate the burden of mental health disorders. Also seeks to integrate mental health services with the Kenya Essential Package for Health. I believe this has now changed to universal health coverage. To promote, respect, and observe the rights of persons with mental disorders in accordance with national and international laws. So the policy describes a few key areas that legislation and policy should cover. This includes mental health leadership and governance. So it describes the roles that national and county governments should play in mental health care. It proposes to increase trained personnel, this is in human resource, to increase capacity and also to increase capacity for the existing personnel. It proposes to increase financial resource allocation for mental health. It also proposes to advocate for for less substance use, because drug use is a leading cause of mental health disorders in the country. Also proposes to increase mental health centers across the country, to use technology, to have mental health information system and a research infrastructure. It provides for guidelines on policy, on advocacy and partnerships to offer mental health solutions. It describes what vulnerable groups are, and also talks about the social cultural perspective. Then, since this plan was in existence from 2015 and up until 2019, nothing much had been seen. This was when the president issued a directive, and a task force on mental health was established. And the task force was established in 2019 and was mandated to study the status of mental health in Kenya, including the legal policy and administrative environment, related determinants and contributing risk factors to ill mental health, and to recommend transformative solutions to reform mental health systems. So this task force submitted a report that gave the findings on what I've just read, and the action plan was launched early this year. So the highlights of this action plan include enactment of a legislation to establish an independent mental health board or an equivalent government institution. It also looks to establish county mental health councils and mental health coordination units. It also looks to review the Mental Health Act and to establish county mental health councils. That's a repetition, sorry. It also looks to establish counseling and wellness units in government ministries, state departments, and agencies. Also looks to enhance mental health literacy. Also looks to promote interventions through community, school, and workplace programs talking about mental health. So it also looks to implement the suicide prevention program, and also noting that looks to decriminalize suicide, because criminalization of suicide further increases the stigma associated with mental health disorders that lead to individuals committing suicide. So it looks to integrate mental health services at primary care and community level by training community health volunteers and primary care providers. It looks to establish county mental health units, to strengthen mental health units to offer substance use disorder treatments and rehabilitation services. It also looks to cover mental health services under the UHC health benefit package. So that means subsidize the cost of treating mental health disorders. And then it also looks to establish a mental health fund to address mental health disparities and establish community mental health programs. Looks to revise curriculums in medical colleges to include human rights and disabilities as it relates to mental health, to prioritize and increase scholarships for mental health professionals, training at county and national governments, to develop infrastructure of community-based mental health services, to improve the Madari Hospital, and also to develop other regional training centers, and also to conduct a mental health survey to establish the burden and resource gaps, and also for KEMSA to develop psychotropic medicines. So my conclusion is that Kenya has been reported to be among the countries with the highest rates of depression. It is worrying given that the country still uses the 1991, I'm not even sure it's the 1989 or 1991 Mental Health Act. It's still very, very old, close to 30 years, unacceptable. So the act is still in the era of very little research. As you can see, it describes a person living with a mental health disorder as a psychopath. It's obsolete. That's all I can say. And that it is crucial to have this mental health policy and the mental health action plan implemented, as they will lead to a change in legislation and the policies governing mental health. So I'm done with my presentation.
Thank you.
I want to see room for questions.
Thank you for that well elaborate presentation, Irene. My question was, mental impairment at times, people suffering from mental impairment at times have lucid moments whereby they are able to reason and perform their ordinary functions of work like normal people in society. So do you feel maybe they could be categorized as people with a disability, so that maybe they can be part of the people who enjoy certain reservations under the Public Procurement and Disposal Act of 2015, which reserves certain tenders for such people with disabilities? Do you feel it's unfair not to categorize them as people with disability?
Well, it depends on the spectrum of the mental health disorder. I'd say for like a person living with depression, you can't really consider that as a disability. It's an ailment like any other. Like it's an ailment like having a cancer or having a TB or something. But for a person who has bipolar, you can call that a disability because they have manic episodes. In those manic episodes, this person is not able to be productive at all. They're probably violent. They also have very, very low moments where they're also not productive at all. So you can call this a person with disability because it really affects their economic participation. So I'd say it depends on the spectrum of the mental illness. Not all of them should be classified as disabilities. Some of them can be treated as regular ailments.
Oh, okay. Thank you. Thank you. I see we have 1 minute remaining, but people have room for questions since some have just joined. Maybe I could ask my co-founder, Angela, kindly come assist with this ICT issue. Angela?
Oh, hi, Rogers. Hi, everyone. Thank you for joining. Because the time is almost up, I'd request that we leave and then rejoin.
Using the same link.
Using the same link, kindly. Just leave and rejoin.
Okay, guys. So you can leave, then rejoin using the same link so that you can have an addition of 40 minutes to continue the discussion.